Jen Laws is an independent policy consultant and an HIV and trans community advocate in South Florida. He is also a friend of RAD Remedy and has worked with organizations like South Florida AIDS Network, and we are really pleased to have him with us tonight.
Hi.
Hey. The Patient Protection and Affordable Care Act, or the ACA, or Obamacare, was passed in 2010, and though what we've heard mostly about it is it's the requirement that everyone needs to have health insurance primarily. This law put regulations on insurance companies, employers, and institutions that receive federal money from HHS and other specific departments. Section 1557 of the ACA is the non discrimination portion and includes gender identity and sex stereotyping, among other things. Between September 8th, 2015 to November 9th, 2015, the HHS held an open comment period where anyone could submit a comment about Section 1557, and over 25,000 comments were submitted, and over 23,000 of them were from individuals. These guidelines released on Friday, May 13th, just 2 days ago, are published responses to the comments as well as the clarification and changes to the proposed rule. On May 19th, Section 1557 will be finalized and published into the Federal Register. This Q&A is specifically about how these guidelines apply to transgender, gender nonconforming, and intersex folks. And we are pleased to have Jen with us tonight to go through this.
Hi there.
So, Jen, who is HHS and OCR? What does this jargon mean, and how can folks understand it?
So, HHS, the Department of Health and Human Services, was actually a department of the government that was formed by the ACA. So they govern pretty much everything that happens with regard to Obamacare, and they're pretty fantastic. Now OCR, there's multiple departments in the government that have an OCR. OCR stands for the Office of Civil Rights. So basically, any department in the government that deals with any potential discrimination is going to have a specific OCR group that handles civil rights issues.
Excellent. So with Section 1557 um, coming forward and being sort of finalized and moving towards that, how would you explain that to sort of a layperson and what that means? And
So, 1557 is actually pretty fucking awesome. Can I say that?
you can absolutely say that.
Um, 1557 comes out and says essentially you're not allowed to discriminate in healthcare, um, with some qualifying statements behind that because the ACA only applies to certain aspects of healthcare, which will be expanded as policy evolves and changes on the federal level. 1557 very specifically includes issues, prohibition on discrimination based on race, age, sex, gender identity. They're a little iffy on sexual orientation, and we will talk about that later. National origin is also included in that, as well as disability, which is the other gigantic piece of the final ruling here.
Excellent. Um, and I know that one of the things that anytime we're talking about non-discrimination law, the piece for trans and gender nonconforming folks and everybody under our scope of concern at RAD Remedy is they build in religious exceptions, and I am trying to understand and make sure that our folks understand how this happens or does not happen within 1557.
So, of the 23,000 comments from individuals, that means that there were about 2,000 comments from community organizations, community advocacy groups, including LGBT advocacy groups, religious advocacy groups, women's healthcare advocacy groups, like anybody who would fall into some form of discrimination prevention, um, pretty much commented, and it that was great. One of the things that got asked a lot was, will there be a religious exemption? Can I sit there and say my religion my religious beliefs prevent me from being able to move forward here, either as a provider or an insurance group that's religiously based, research institutions, health research institutions that receive funding here. Um, if they're religiously based, will they be able to discriminate? And the answer is no. HHS soundly rejected an appeal and request for religious exemption. Um, that Now the qualifying piece to that, as everything here has qualifications, um, this does not override federal guidelines or laws that already offer religious protections, like the RFRA, or Religious Freedom Amendment Act, not amendment, Act, or provider conscience laws. So if an individual goes to their provider and says, I want this no matter what, and the provider says, I can't in good conscience do that because it's not good for you medically, they are not required to do so under this.
I see. And what, um, as far as this 1557 goes, like who all is impacted by this in the sense of like what plans and employers, and what protected classes of people who are bound by it?
Well, we talked a little bit about the protected classes. I'm going to bring up the actual list of protected classes because I want to make sure I get all of them um, for you. Just a second. In terms of providers that are affected, plans, things like that, anybody who receives federal funding assistance that's covered um, under the ACA is who's affected. Marketplace plans, Medicare and Medicaid. That's the big one. There's a huge exception to the Medicare piece, and that's Medicare Part B is currently not considered a federal funding assistance piece. When Medicare is up for reauthorization in 2018, HHS is going to recommend that it be considered federal funding. So we could see that change. If that change happens, then 99% of providers and plans that operate through the US at all are going to be affected. Right now, it's a little less of a scope, but we're getting there. And that's really kind of the awesome piece. In terms of plans that are affected or insurance providers that are affected, um, there's 157 insurance providers or insurers that use the federal marketplace. And application of 1557 means that even if the plan that if an insurer is accessible through the federal marketplace or even state marketplaces through the ACA, they have to conform to this rule. Um, Even if they offer a plan that's not part of the marketplace, all of their plans must conform, and that's pretty awesome. So Aetna, Cigna, Humana, all of the big ones, Blue Cross Blue Shield, it's pretty amazing. I'm
The other,
distracted.
well, I ask you really quickly. One of some of the other folks that we've been doing some work with here at RAD, are active duty and veteran folks, and a lot of times they're interested in knowing whether the VA is covered under this, and also whether TRICARE plans are covered under that.
So, sort of.
Okay.
Um, that is technically a form of federal assistance, federal funding assistance, but they're also operated separately from HHS. So they have some impact from the ACA. They have in other places they don't. The HHS is going to dig more into that, and I expect much like Medicare, Medicaid, CMS. Is going to see a push of change of language around what constitutes federal funding. We're going to see some of that there too.
Gotcha.
The protected classes under 1557 include race, color, national origin, sex, age, or disability, as well as sex stereotyping. So That's kind of awesome because what that means is that individuals who do not conform to specific binary gender are also affected by protections of 1557.
That's awesome.
What
Um,
this means
go
I'm
ahead.
sorry, go ahead.
You had.
We're so polite. We're going to keep doing this. Um, so employers, large employers, any employer that employs more than 50 full-time equivalent employees are affected by these plans. They're required to offer health insurance. So they're also required now to conform to the non-discrimination rules. On top of that, uh, the ACA also has a provision that allows for tax credits and funding assistance for smaller employers. If they receive any of that, then they are required to make sure that their plans fall under that as well.
Excellent. And when all is this effective? I know you mentioned 2018 for some changes that might be coming down the pipe, but for the rest of this, when does this happen?
By and large, most of these rules are effective beginning July 18th, 2016. Now, if you're in the middle of a plan year, the benefit design is not required to change until January 1st. So if you're already in a plan, they don't have to change until January 1st, 2017. Uh, but you'll see those plan offerings, the difference in those plan offerings coming out during open enrollment periods, October, November, that kind of thing.
Cool.
So.
And we sought out some questions from the community so that we could understand or help folks understand the nuts and bolts of this, and I'll go through those now with you if you don't mind.
Okay.
Uh, Somebody asked, will testosterone injections for F to M or trans men with a female gender marker of record be covered by pharmacy insurance, which covers testosterone for men or male folks?
So we're going to talk in general hormones, not just testosterone, because we know that a wide variety of individuals with non-traditional gender identities are seeking coverage for hormone therapy. So in most cases, um, the the OCR chose not to provide prescriptive requirements of coverage. And they focus specifically on non-discrimination. OCR did not come out and say that hormones or surgery even are required to be covered. What they said is you can't discriminate. So if if a insurance provider or a pharmacy plan covers hormones for women in menopause or men in andropause, cisgender individuals, then they are also now required to cover it for transgender individuals in most cases.
Interesting.
Mm-hmm.
Will gynecology related services be covered by medical insurance for female to male or F to M or trans um, men post gender record change to male?
Yes. So the nice little piece about the ACA that's not part of 1557, it's a part of a different piece of it, is that certain aspects of annual care are considered essential health benefits. And your annual PAP, an individual's annual PAP, is part of that. So now that an insurance provider can't discriminate based on the gender marker or the sex of the individual, they can't say, well, now your gender marker's M, so you don't need a pap smear. Uh, that can't happen anymore. That is absolutely required to be covered.
That is a game changer.
Indeed. Indeed. On top of that, providers are no longer allowed to discriminate. A trans man can walk into any GYN office with their insurance card, say, hey, I'm here for my annual, and the provider is not allowed to say, I don't want to deal with you because you're a
Wow,
dude.
that's
Yeah,
awesome.
that doesn't happen. Well, it's not allowed to happen anymore.
Mhm. Um, Also, folks are asking, does this protection for 1557 extend to minors?
In most cases, yes. Um, the OCR is still going to defer to providers in terms of what they recommend for minors, but minor coverage is extended to the age of 26 under their parents' plans under the ACA. So for the most part, the answer is yes.
Cool. And I think we covered this, but somebody was asking if Medicaid is included. I know you mentioned
Yes.
Part B being
Yes.
being
See, well, Medicare Part B is different
oh, Medicaid.
Medicaid. Let's distinguish that real quick.
Yes, please do.
Um, Medicaid was expanded under the ACA. States had the option to expand Medicaid to fill the gap of where the health insurance subsidies will reach. Some states chose not to. They're by and large run by Republican governors, and we won't get into the politics of that. So, in states that expanded Medicaid, and you're seeing individuals on Medicaid, they are not allowed to discriminate anymore. CMS, which is the Centers for Medicare and Medicaid Services, will be issuing guidance and changes of plans for January 1st, 2017. So
Awesome.
it also means that providers who accept Medicaid are required to conform.
Um, this one is one that I'm particularly interested in. Are insurance plans through work still allowed to exclude coverage for transgender care?
For the most part, no. We talked about that a little bit just now. Employers that are 50 employees or larger, full-time equivalent employees. So full-time equivalency is a weird thing to say. It's like, well, 40-hour work weeks. One of the things that was discussed is that employers might cut their employees down to part-time to avoid this. And so what the federal government said is if you have two employees who are part-time, but together they make up full-time hours, that's full-time equivalency. So you have to offer health insurance for at least one of them. And because employers typically don't want to upset things between their employees, they will end up offering it for everybody. So employers who are affected and offer plans coverage through because of the ACA, they are no longer allowed to have blanket exclusions of care, and that's really the biggest way. That's how OCR decided to phrase this. Is they're not being prescriptive for care. They're not saying that a insurance provider must cover these things. They're saying that you can't exclude them. It's which those are not the same language. So you're no longer going to see, very specifically, you're no longer going to see, we don't cover this because it's experimental. We don't cover this because it's cosmetic. OCR roundly rejected that idea. Um,
And does that extend to all of the sort of myriad of transition modalities? Like, does it?
yes.
Okay.
Part of the reasoning behind why OCR decided not to be prescriptive, there's two reasons. One of it's not in their reach. They are not allowed to be prescriptive in what should happen in terms of treatment and care. But the other part is because OCR wanted to leave room for updates and standards of care for trans people. So, as this is an evolving landscape in terms of healthcare for trans folks, OCR wants room to be able to do that. So,
Excellent. Um, will insurance plans still be able to exclude, for example, vaginoplasty, which is a procedure that overwhelmingly only trans women have a need for?
so vaginoplasty is actually something that older women tend to run into quite a lot, and cisgender women, because of falling of vaginal walls, um, uterine prolapse. Vaginoplasty is like really we're as we evolve to understand that cisgender women of a certain age require certain and specific care. Um, that is a plan benefit that does need to be covered. Insurance companies are starting to understand that. So what it means for trans women is that if vaginoplasty is covered um, for cisgender women, it needs to be covered for trans women. Now, part of what we talked about, what you're going to see is, you know, OCR has decided on a case by case basis. It will evaluate if changes in plan design, like the formulary, is discriminatory. One of the big concerns that came out of the original ACA discussions was, so you're required now to cover type 2 diabetes and type 1 diabetes medications. Um, Insurance plans can do that, but what if they decide to put them on the top tier of medication? Well, OCR has decided they will evaluate if that's considered a discriminatory. Moving things to the top tier, like hormones, would be considered a discriminatory, in an effort to avoid coverage. It would be discriminatory toward trans people. So if that kind of movement it happens on a case by case basis, OCR will evaluate that. They will work with the insurance provider to say, hey, why did you move these drugs? Why did you move this level of surgery to this type of category? It's late. Category. Um,
I got.
so,
um, I, I'm not familiar with the. You'd think with all the work I do that I know this, but how does what's the process or the sort of factors that would go into things being identified as a top tier in the formulary?
um, so insurance providers, in terms of formularies, they evaluate costs, they evaluate efficacy of care around that, impact on individuals in terms of that efficacy of care, how often it's used, how necessary it is, like medically necessary, um, which will evolve, which involves a panel of insurance hired doctors. Obviously, it's in their own interest to eliminate high cost situations, um, which is unfortunate. The whole reason we have insurance is to cover for when we can't cover these things on our own. Um, it's to make sure that we're not at a financial disposition, but insurance companies need to do the same thing for themselves. So if they believe that it's going to end up costing them more than what it's worth, whatever they choose to rank that as, they're going to try and push it higher up the formulary to make it more difficult for a enrollee to use.
Gotcha.
Mhm.
Um, if my insurance company still denies my surgery or hormones, what do I do?
So there's a process to that, right? That process will involve filing a complaint with OCR. So if you believe that you've been discriminated against because of your plan coverage, you get to we're going to include a link, aren't we, Riley?
Yes, we are.
Um, you will file a complaint, and OCR will walk you through what that complaint means. Now, the interesting part is they can choose to withdraw federal funding assistance. They can, but that's not going to be their first step. Their first step is going to be remedial. They're going to educate them about their rights and responsibilities under the ACA. They're going to um, say this is why we believe this is discriminatory toward this particular patient, and how it might be discriminatory across the board. And then if the insurance company is then still resistant, they can start to remove their ability to be on the marketplace. They can remove federal subsidies and funding. They can make it impossible for the insurance company to operate for Medicare or Medicaid. These kinds of things begin to really impact uh, the profit and the viability of insurance companies. So they're gonna money's the big way to talk, and OCR is totally not shy about being able to do that. Um, One of the other things about how this works is employers are responsible for the type of plans they choose and offer, especially for self-insured employers. So if OCR determines that this is actually an employer discrimination issue, they will refer the complaint to the Equal Employment Opportunity Commission, and there's department agreement there about what that would mean for a person filing a complaint. If you file with OCR and OCR says, we think more of an EEOC thing, they're gonna honor the initiation of complaint with OCR. They're going to work together to make sure that the individual is cared for, and that every aspect of care can happen. The other thing, the final aspect of what could happen if there's a denial of care or a delay of care, we'll talk about that in a moment, is that you could file a civil suit. It is totally within a patient's right to file a civil suit against an insurer or a provider, um, or in some cases, schools and research institutions, as they are technically receiving federal funding assistance through student loans, and many of them do, or hospitals that receive federal funding assistance are also covered. So lawsuits are totally an option. They should not be your first one. Um, so
Um, and if somebody, if they're having issues, should they report this to OCR or EOC, or should they still try to go through the insurance appeals process?
they should absolutely go through the appeals process and contact OCR. You want to do both. And because part of what's considered discrimination is if there's a delay of care. So, say I get my testosterone prescription, and I decide I want to go get that filled. Um, at whatever local pharmacy, and that's in the formulary, that's in agreement with the insurance, and they said go to this pharmacy, and I went there and they said, well, your testosterone's not covered and that's going to be $110 out of pocket today. um, that's a delay of care for me if it takes me to appeal that. um, that is considered a form of discrimination if it's otherwise covered by the insurance company. So delays of care are also considered discrimination, even if they eventually, like, you go through the appeals and you eventually get the coverage you need. If my care or your care or an enrollee's care is delayed because of that appeals process, um, that's still considered discrimination. Now, what that means is that a lot of insurance companies have automatic disqualifying um, markers in their systems. So you get a computer generated letter that says, I'm sorry, we've denied you because this isn't appropriate to your gender. Well, that's not okay
Just a
anymore.
few of those.
That yeah, I've got several of them myself. I know we all got some feelings about that. So that's not okay anymore. What OCR suggested to insurance companies that were concerned about this is that they communicate with providers for specific coding for individuals who are gender nonconforming or have a non-traditional gender identity, so that that is flagged in their systems. So before there's a denial, someone has to see that. Like, they're trying to move the automated process um, in such a way that individuals don't end up having to wait for the things that are important to them. We know that trans individuals will forego care, all care, if they can't, like, for the most part, will forego all care if they can't get the transition related care they need. So that's OCR is very aware of this, and they did not want to see that happen. So they're really pushing for this to be as comprehensive as possible.
What would you say RAD being what it is, we have providers that we work with, and we try to help them improve their practices. What are their obligations in this?
So providers have actually a fair amount of obligation. If a provider receives federal funding, they're also not allowed to discriminate in their employment practices. So now, if a provider uh, says, I don't necessarily want a trans person on my staff, even though we're still navigating that space with the EEOC, HHS could then step in and say, listen, if you didn't hire a trans person because they're trans, we're going to look at taking away your federal funding. Um,
Interesting.
yeah, it's kind of awesome like that. The other the other thing that's happened from time to time is insurance companies have decided that they wouldn't have a provider on their list because that provider is trans, and they're not allowed to do
Oh.
that anymore either. If they receive federal funding, they're not allowed to discriminate in the type of provider someone is. So if the provider is under that protected class, um, and they would traditionally be a network otherwise for an affected insurance company, they're not allowed to discriminate either. So I mean, it is across the board not allowed to discriminate. Um, I and for providers that receive federal funding, and it has to be direct, um, they need to really make sure that they're up on cultural competency. Um, and I think RAD totally has room to get involved at that point in time, um, to educate providers on what their obligations are and how to be as competent as possible. We know that more than 50% of trans people end up educating their providers about what their care should be, and that's really not fair. I mean, it's great to have that kind of relationship, but it's really not fair to the patient when they're coming to a healthcare provider for these services. And I think RAD totally has room to make sure that trans folks are getting the care they need, with competent providers.
And we actually have a practice called Remedy on Demand, where we are able to review forms, systems, and practices, and help providers improve them without any judgment or any drama. We want to make sure that folks are doing the best that they can. And if folks are interested in that, obviously reach out to us, and we'll absolutely touch base with where the the good parts are and where there is room for improvement.
Hmm.
Um, I wanted to, thank you so much for your time. And, viewers and users, if you have questions about 1557, please send them to us and we'll get some answers for you. And RAD Remedy is here to help the trans community get the care that we deserve, and we will work with you and your provider to make sure that your needs are met. And if you have questions, you can also send them to us on social media. We're going to create a hashtag, which is RAD1557, RAD1557. And we can, talk questions about that then and hunt it down. We also do it via email at info@radremedy.org. And feel free to check out our website, radremedy.org. We've got many providers there who are up to date, hopefully. And we want to know, the other part about this is that we want to know the good, bad, and the ugly. So if you see providers, please review them and help everybody out that way. Thanks so much for your time, Jen.
You're welcome. You're welcome.
Have a great night.
You too.